Almost every day, a television doctor or a health food advocate encourages us to take more of a particular supplement, powder, or pill to keep us alive, well, and long-lived. Most of us try to follow that advice and stay away from the delicious, sinful foods. What few experts have told us till now is that some sinful foods are brimming with a healthy vitamin K that we need, and too much calcium could be harming us. The confusion of it all. Dr. Kate Rheaume-Bleue is a naturopath and expert in natural health. Her new book is called Vitamin K2 and the Calcium Paradox. It is my pleasure to welcome Dr. Kate Rheaume-Bleue back to Studio 4 to tell us more.
Hi, Fanny.
Now what? The calcium paradox?
The calcium paradox. Calcium can get into the wrong places in the body. For so long now, we've been told, take calcium and more calcium to help your bones. And it does help our bones, but new studies show that calcium from supplements and from food can get into our arteries, leading to hardening of the arteries, leading to heart attacks and strokes, and more so in people who take calcium supplements.
So how do you get calcium to go where it's supposed to go?
Well, that's an excellent question, and it turns out the answer to that is a little-known vitamin, a vitamin that essentially was overlooked since it was discovered, called vitamin K2. And it literally will guide calcium into bones and teeth where we want the calcium to be. And not only will it keep calcium out of arteries, but it's been shown to even reverse existing arterial calcium plaque, existing hardening of the arteries. And that's something that we have never seen before.
Were we getting it in the past? Are we not getting it now? Was it in the food supply? Is it gone? What?
Exactly. This nutrient used to be abundant in our diets back, say, 100 years ago when all animals were out on the pasture. Cows, chickens, pigs, when those animals are eating grass, a grass-based diet, then those animal products, so egg yolks, butter, the meat, and the fat in the meat, will be very high in vitamin K2.
From the grass?
From the grass.
Grass-fed Angus.
Exactly. So over the last 100 years, as we've removed animals from the pasture to confined grain feeding, we've basically eliminated this nutrient from our diet. And that has paralleled this increase in heart disease and osteoporosis and cancer and a number of other health concerns.
Fascinating. So the feedlot might not be so good for our insides. And I know that as a funny connection. But it makes sense to me that if we change something dramatically, still grass-fed beef, certainly a lot of grass-fed beef in Australia.
Yes, yes.
And other places.
Yeah, some places in the world, they still do this, and for a long time it was the only way of raising meat. And there's grain-fed is now even promoted and often touted and advertised and marketed, but we're missing a really important nutrient when we do this.
Is it dramatic to say too much calcium could possibly kill us?
No,
or
not at all.
Or send us down the road?
No, as a matter of fact, multiple studies now have shown that calcium supplements can increase the risk of heart attack and stroke by about 20% in women. But this story isn't just for people who take calcium supplements, not just for women. Whether or not you take calcium supplements, heart disease, which is essentially this hardening of the arteries, this buildup of a calcium-laden plaque.
Calcification of the arteries.
Calcification, exactly, is the #1 killer of both men and women. So, so the key here is not just to abandon calcium supplements necessarily, but make sure we have the nutrients to guide calcium where it's supposed to go safely.
So to take calcium supplements or to avoid them like pleated pants, I think that was the question in your book. Yeah. But we want strong bones, obviously, and we want clear arteries. So how do we know if we have K2 or we don't have K2 in our bloodstream, in our bodies?
You can pretty much assume that you don't. In 2007, researchers showed that most apparently healthy people, and that's the key word, is apparently, are deficient in vitamin K2. In other words, we don't have enough K2 to guide calcium to the appropriate places on our body. And you won't necessarily notice that because you can't tell by looking at somebody that their bone density is declining, that they're building up plaque. Even with all the testing we have, most heart disease goes unnoticed.
Yes.
And it turns out that vitamin K2 plays a major role in preventing and reversing that.
First symptom of heart disease, sometimes sudden death.
Sometimes
not
it is.
So good.
That's right, yeah.
So where does cholesterol fit in this picture? High cholesterol, low cholesterol?
Well, the fact is that 50% of people who have heart attacks have normal cholesterol levels at the time of their heart attack and no history of ever having had high cholesterol. So, you know, we've all heard of this person he was 50 years old, he jogged every day, he had the perfect diet, normal cholesterol, and then he dropped out of a heart attack. And whether your cholesterol is high or low, you can have plaque building up in your arteries. If your cholesterol is really high, that may be an important red flag for heart disease if you've got it. But if you don't, that doesn't say anything about your risk of heart disease. So we need to kind of keep cholesterol in perspective, because to a certain extent, by just focusing on cholesterol, it's led us astray. We need to focus on what heart disease is, which is calcium plaque.
So back to the sinful foods, or forward to the sinful foods. Some sinful foods are good for us because?
Because they're brimming with K2. So look at the French diet. For the longest time, we marveled at the fact the French could eat all this rich food and smoke like chimneys and have low rates of heart disease. Well, it turns out that brie cheese, pâté de foie gras, butter, those creamy sauces, those foods are some of the highest foods in vitamin K2 that will clear your arteries out.
Why? Because they come from grass-fed beef or chickens that scratch and run around the yards, or what?
Sometimes. So in the case of the French, they're more likely, yes, to produce their butter and eggs on a
In
smaller
all of Europe.
scale. In all of Europe,
Yes.
that's right. But there are certain foods like the brie cheese. We here can benefit from brie cheese because it doesn't matter if the milk that went into it was grass-fed. It's the bacteria that makes the cheese that will give the K2. So brie is high, Gouda is high. Certain cheeses have this nutrient. Cheddar has a little bit, but not a lot. It depends on the bacteria that makes the cheese.
Tell me about the bean thing, the legume thing. That was
Right.
really interesting in this.
So, yes.
Moldy beans are good for us was kind of what I got.
Pretty much.
Explain that.
A specific kind of moldy bean. So the Japanese, you know, they're famous for their low rates of heart disease and low rates of osteoporosis, and even less facial wrinkling among Japanese women. And it turns out that is because of a special food called natto, N-A-T-T-O. This is a Japanese fermented soybean food, essentially rotten soybeans. They are slimy and sticky and quite smelly. It's sort of an acquired taste. In certain areas of Japan, they eat this as a breakfast food, and where they do, that's where they have very low rates of osteoporosis and heart disease.
But how it came about is the most interesting.
Oh, well, it was essentially an accident. Some Japanese soldiers were boiling up some beans to feed to their horses, and they were attacked by an invading army. They left their beans on some hay, came back a few days later, and the beans had gone rotten. But that's all they had to eat, so they ate them, and apparently they liked them. I'm not sure about that. They brought some to the emperor. He liked them. And then this became a traditional food, these fermented soybeans. So,
And they were healthy. They had nothing else. They had this, and somehow they were healthy. And I'm not saying it's the magic substance, because I hear it tastes like old socks.
Pretty much, yes.
Not so good.
Yeah.
Can you hide it in rice or something?
I try. You know, I do give a recipe in the book for natto fried rice that was the best one I found. It was challenging for me to find the natto, and then learning to. It's easy to cook, very easy. It's pretty much, you know, you thaw it and you mix it up and that's it. But the learning to like it and the texture, the slimy texture of it, was a real challenge for me.
I know that you sign books when you're in town, and you'll be in West Van today around 11. You're going to White Rock tonight, and there'll be a run on K2. But it's a problem in a sense, because people don't know if they have too much or too little K2. They're trying to figure out what to do. Women who are taking so much calcium think, oh my gosh, I shouldn't be. What to do?
But you know what? The good news about K2 is there's no toxic effects.
Is it fat soluble?
It is fat soluble, so good to take it with your meals. If you've been taking calcium or vitamin D, K2 is essential to guide those nutrients and have them help us, you know, do what we want them to do. Very important for women who are pregnant and expecting, for children's health, preventing dental cavities, ensuring proper bone development in children as they age and throughout adolescence.
Because the darling of the vitamins lately has been D.
We've heard so much about D, and D and K2 work together as partners. D, and the reason why we all take D, one of the main reasons is it will help us absorb more calcium, but once the calcium's absorbed, has no control over where it goes. So that's where K2 takes over and moves the calcium around. So D and K2 really, they work really well together.
As patients come to you and talk to you about atrial fibrillation, heart's
yes.
going too fast, all of that, can you reflect on too much calcium, or does that have anything to do with it?
There are lots of causes for atrial fibrillation. It's becoming a more common concern. The important thing there is that people not necessarily resort to blood thinners right away, because being on blood thinners, when you've got that, can exacerbate the problems we're talking about with vitamin K deficiency. You know, an aspirin is a better choice. But inappropriate calcifications can happen anywhere in the body and even in the heart. So that's why I've got case contributed by a cardiologist who's used this to reverse calcifications.
Right. And what about inflammation? As you know, most diseases are inflammatory.
Exactly. Yeah.
Not most, but many.
Right, many. And heart disease is certainly one of them. And eventually that can increase the risk of calcification in inappropriate places. And even in, for example, skin tissue, microscopic calcium deposits in the elastic tissues of the skin, which will lead to facial wrinkling. So K2 has a benefit here. Yeah, that's
well,
good
the
news.
Shelves will be empty.
That's right.
Now that you said that, but I know it's not that simple. If you want to eat so that you get K2 and balance and calcium and all of that, what foods? What foods to avoid, what foods to eat?
Well, we need to look back at old-fashioned ways of farming and producing our food. So looking towards grass-fed foods is the number one things. Avoiding trans fats, very important, because those will inhibit our body's utilization of this nutrient. I recognize that it's not easy for everybody to find as much grass-fed food maybe as they want, but look for the eggs with the really nice orange yolks, which here on the West Coast you can get them almost year-round. So that's important. Certain fermented foods, again, like we said, brie cheese, Gouda, I've got a whole list of them in the book. Yogurt, not so high. Yogurt's good, but it's not so high in the K2. The bacteria just don't make it.
Okay, what about lentils?
Lentils, no, not necessarily. Actually, the only vegetarian or vegan food for K2 are those natto fermented soybeans.
Back to natto.
If you're a vegan, you absolutely have to eat natto.
K2 is fat soluble, vitamin D fat soluble.
Yep.
What does that mean exactly, as opposed to a water-soluble vitamin, like a C?
Yeah, that means you'll find them in a fat medium, so that's why you find this in the yolk of the egg, but not the white, or higher in butter, or in the fat of the meat. So you find them in fat in foods, and you absorb them with fat in your diet. So that's really what that means.
And too much protein, will that leach calcium out of the body, or is a lot of protein good? Should you eat a lot of quinoa, or what?
Yeah, no, I wouldn't say that too much protein is a problem. It's more of how the protein that you're having is produced, and making sure if you have a lot of protein in your diet, you have enough fat and fat-soluble vitamins to utilize that properly.
Is K2 a vitamin that is in most multis? Or not
yet, no. You have to look for specific multis that have that. It is widely available now in most health food stores and some drug stores. You can get K2 supplements either on their own or with vitamin D or as part of a calcium supplement, but you have to check the label to make sure it's there.
Because we read often about CalMag. You need magnesium in order to absorb calcium, and I don't know how that works, but now you're suggesting we need K2 in order to direct calcium to the right spots.
Yeah, calcium and magnesium, they're like partners, salt and pepper, night and day, they go together, but exactly, then we need K2 to move calcium to where we want it and guide it around the body.
If we do it right, Ken, do you think heart disease at some levels is reversible?
100%.
Again, not the magic answer. I know we'll have a cardiologists ring up immediately, but you know what I mean. Like, is there a way?
A cardiologist using this in the book to reverse arterial calcifications. We've seen this in animal studies and human studies, and there's clinical trials ongoing right now. Scientists conclude that this is the single most important mechanism by which the body can prevent and, yes, reverse existing heart disease.
And what about GMOs, genetically modified foods?
That's still
How do you fight that battle?
Well, that's still an unknown as to, it's so difficult for us to understand exactly what they're doing, since we don't know what they're doing. We don't know how to fight them. So maybe the best way is to avoid them until we can be sure.
So in essence, the Greeks, the Italians, the French have some of it right.
There was no paradox
Perhaps
at all.
a lot of it, no
lot
paradox.
There's no, that's right. They can eat these rich foods and enjoy their wine, and it turns out those foods are giving them the one nutrient that will just keep their arteries clear, prevent cancer, do a number of things.
You see, it gives it. There's justice in the
There's
world.
justice. So
If it's all so, and you say the studies are scientific.
every statement I make is evidence-based. It's all backed with research, and there's more research coming out every day about the benefits for kidney stones, for multiple different types of cancer, for dental health. It's more than just brushing and flossing, but having these nutrients. It's a lot of research.
Sure.
Yeah.
And that wrinkle thing.
And the wrinkle thing, you know what? People will run off with it for the wrinkles, and we can say, hey, it's good for your bones and heart on the way out. But
Exactly, that too. The heart needs to beat.